Hi everyone, welcome to another episode of Flourish FM, a podcast for the good life. Our guest today is Dr. Judith Joseph. Judith is a world-renowned board-certified psychiatrist and researcher specializing in mental health and trauma. She is the founder and chief investigator at New York City's premier clinical research base, Manhattan Behavioral Medicine, assistant professor in child and adolescent psychiatry at New York University, and chair of the Women in Medicine Board at Columbia University. Judith conducted the world's first peer-reviewed clinical research study on high-functioning depression in her laboratories. She recently published her instant national best-selling book based on this study, High Functioning, Overcome Your Hidden Depression and Reclaim Your Joy. She has become the world's leading voice on high-functioning depression, and that is part of the focus of our conversation with Judith today. Nick, what did you enjoy most about our conversation with Dr. Judith Joseph?
Yeah, I mean, she's obviously brilliant, has so many good ideas. I think what I enjoyed the most was, in many ways, the way those ideas kind of synergized with other topics and episodes. And so high-functioning depression sounded really similar in some ways to toxic productivity conversations that we had with Eastern this year, for instance. We brought up the kind of the dopamine system and addiction and mental health and whatnot. And anhedonia, right, with Anna Lemke. And Judith brought us back to both of those, but from a different perspective and kind of a different angle and with slightly different language. And so I walked away feeling like if anyone that she describes, which is somebody who's maybe like really doing well at work and productive and effective and all those sorts of things, but has this sort of undertone that something's off, there's a really good chance you're going to find something in this episode, and the way she details how we use those to avoid and cope and whatnot was just a really nice journey, I think, into a lot of people's psyche that they may be, sort of unconscious of. And so my hope is that they'll find a little something here from Judith.
Absolutely. We certainly hope you do. This is Understanding High Function Depression and Reclaiming Our Joy with Dr. Judith Joseph. Dr. Judith Joseph, how are you doing? Thank you for joining us today.
I'm great. Thank you for having me. How are you?
Very well.
Doing great.
Very much. Yeah.
Good.
We're really excited to have this conversation with you. We've loved reading your book, High Functioning, and you are a scientist and therapist who studies happiness, and you conducted the world's first peer-reviewed clinical research study on high-functioning depression, which we'll call HFD from now on, in your laboratories. And the findings of these from that study you summarize in your excellent recent book, High Functioning, Overcome Your Hidden Depression and Reclaim Your Joy. So let's start by getting clear on what exactly this is. What is high functioning depression?
Well, as someone who studies schizophrenia, depression, anxiety, ADHD in my lab, and develops or helps to develop medications and new treatments, I have to use something called the DSM-5. And in research, we have this like huge kind of like Bible that we pull out, and then we have to go through a checklist with patients to make sure they meet criteria for these clinical studies. And it's important because if you don't meet criteria, you're not included in the study, and we move on with other patients. But what I was finding was I'd get to the bottom of this checklist of major depressive disorder, and many times people would have these symptoms of depression, but they were still functioning. In fact, they weren't just functioning, they were over-functioning. And they weren't necessarily acknowledging being in distress. And so when you look at this Bible of psychiatry and you go down the checklist, if you have symptoms of depression and you don't meet the bottom two criteria, then you don't get qualified. You go on. Your doctor will say, well, come back when you break down.
All or
come
nothing.
back when you're in crisis, right? And so doing this for so many years, it just got me to thinking, why are we waiting for people to break down? I was looking at all of my other buddies from medical school who are into these very innovative fields of preventative medicine. They're doing longevity work in women's health. So they're talking about hormonal health and preventing osteoporosis. They're doing all of this work, in these other fields of medicine where they're looking at movement and they're preventing the cancer from starting. They're preventing, people from going into stage 4. They're not saying, oh, let's wait till you're in stage 4 and then we'll do something. They're saying, let's prevent this. And I just thought, why are we in the dark ages here in psychiatry? Why are we literally waiting for people to check that box of breakdown or lose functioning? And, for any therapist who's listening or anyone who's in the mental health field, we're fully booked. I haven't taken new patients in my private practice since 2020. And it's really hard to refer patients out to other professionals. You really have to be like, hey, can you do me a favor? Because the wait lists are so long. And I was just reading an article where they're saying that so many people are going back to school to become therapists because there's just this need for mental health professionals. So we know the need is there. Why do we wait for people to break down? Let's teach people how to recognize the signs that they're not doing well before they break down. And even in high achievers, even in people who have it put together, they struggle with something called anhedonia, which is this sneaky symptom. It's a lack of pleasure, interest, and joy. And most people have never even heard of it. So let's teach people that, not having joy in life, not enjoying things that used to bring you pleasure, that could be a warning sign that something else is happening. So let's teach people how to, identify these signs before they break down. And that's where this book, came into play. And this research I find really interesting because it's taught me to look at mental health differently. I'm not just focusing on the people who have broken down. Let's actually support people before they break down.
Yeah. Yeah, I love it. Proactive, preventative, makes a lot of good sense. You just used a really interesting word there right off the bat, which I think was sort of like overachieving or overfunctioning, I think it was. I would love for you to sort of crystallize what you mean by that, because it sounds like, you could check all of these symptoms of sort of how we stereotype depression, but the one you aren't check is the functioning piece. You're actually almost on the opposite end, it sounds like. Correct me if I'm wrong here. What does it mean to overfunction like that?
Well, being in New York City, in a very busy part of New York City, I see two type of overfunctioning overachievers. I see the person who's loving what they're doing, who's deriving a sense of joy, who's busy, but it's still lighting them up. And then I see the person who's doing a lot, looks perfect on the outside, working hard, checking all the boxes, but lacking pleasure. So listen, if you're achieving and you're doing what you're doing and you're still deriving a sense of pleasure and joy, more power to you. But there's a lot of people who aren't. Like, they are feeling that something is off. They can't put their finger on it. They're doing things. They can't sit still. Even when they're outside of the workplace, they cannot relax. They feel empty when they sit still. They feel restless when they're not busy, and they don't know what it is. And in these people, what I found is oftentimes there's some past pain that hasn't been processed. They're outrunning something from the past, and they think they're chasing happy, but they're actually outrunning or trying to outrun pain. And in these individuals, this word anhedonia is like this aha word for them. They're like, oh my gosh, I never knew that this word even existed. I didn't know there was a term for it. I just thought something was wrong with me. And there's a lot of internalized guilt and shame and blame. They feel as if, well, why can't I be happy? Maybe something's wrong with me. Like, everyone else would be happy in my shoes. So this word is super validating for these individuals, because when they know that there's a lack of joy and pleasure, and there's a term for it, and that this term has actually been well studied in the medical literature, and it's validated in the science, then they feel like, okay, well, maybe I can do something about it. There's nothing wrong with me per se. That this is for a reason, and it's not me.
Fantastic. Thank you so much, Judith. So just to get clear on what exactly then high functioning depression is it someone who's performing very well? They seem to be on the surface functioning really highly in their role, in their work, but they're also suffering from anhedonia, the inability to feel pleasure, especially with things that once brought them joy. And they're trying to escape from a past trauma by immersing themselves in these things that they're functioning very highly in, for example, their work. Are those kind of the three conditions, or are there others as well?
No, that's very well explained. And if you look at the paper that I published, you had to meet criteria for those checklists of depression, but not the bottom two qualifiers, which is you break down or you're in distress. So there really is no criteria for these folks who have all the symptoms of depression, but they don't break down. There's really nothing for them. And so that's how we clearly laid it out in the paper, because we had to have a criteria for enrolling patients into this study when we submitted it to the research board. But essentially, it is what you said. You have all these symptoms, you haven't broken it down, And we think our hypothesis is that you're busying yourself to cope from this past pain. And that's why we included the trauma inventory, because we wanted to see what traumas were correlated with it. And classically, with trauma research, when you're looking specifically at PTSD, again, using this DSM-5, the trauma has to be, according to DSM-5 for PTSD, life-threatening or an assault or near death, something that happened to you or someone else that you know, or you learned about it or you witnessed it. There really isn't room in that criteria for other types of trauma, right? And that's why I wanted to create an inventory that had the neglected types of traumas, right? Like things like, maybe you didn't have a lot of food or resources growing up, or maybe you were excluded and your livelihood was threatened because of how you identified. So these are things that are emotionally painful. They shape who you are. They shape how you interact in the world, how you perceive yourself in the world, but they don't get acknowledged in the classic trauma literature because it's very narrowly defined. And so when I brought in this trauma inventory, what I used were other inventories that are more modern. So one called the ACEs, which is the Adverse Childhood Events Questionnaire that many people are familiar with, but also the modified ACEs, which was used to encompass experiences of those who are of other socioeconomic backgrounds. And then I also included other types of traumas like collective traumas, because sometimes it's not what you've experienced or within your lifetime, but it's generational, that's been passed down to you. And you're not even aware as to how that is impacting your present day behavior. And that's why I included my own personal trauma tree in my book, because I'm a board certified psychiatrist and researcher, and I wasn't even fully aware as to how my past generational trauma impacted my present day behavior. And I study this stuff, and I've been in therapy for years. So I think it's not as obvious as you would think it is. Sometimes you do have to do a bit of reflection and use these tools to understand, how you got to this place, why you can't sit still, what is it that you're trying to outrun, so that you can take the necessary steps towards changing these behaviors.
Early on in the show, we had on Anna Lemke. Do you two know each other? She's got do you know her book, Dopamine Nation?
Yes. I've read that.
Okay, great. So it feels really synergistic in a lot of ways with what you're talking about. And obviously she writes plenty about anhedonia as well. My dissertation was on eudaimonia. So all these nerdy words I'm familiar with, but as is John. I think the question in my head then, or maybe it's not a question, but when we were talking to Anna, it sounded like, hey, there's this dopamine chase, right? And ironically, that dopamine chase can lead to anhedonia. And now as I'm listening to you, I'm starting to think, is this dopamine chase coming from or spawned by an avoidance strategy, right? Coping strategy, whatever you're saying, is where she was talking about it as if we're chasing something pleasurable. It seems like you're in some ways coming from the other side of the coin, and we're really trying to avoid something deeply unpleasant, but it's coming to maybe the same conclusions or outcomes. But am I misunderstanding that?
No, I think what you're talking about are the different routes to anhedonia and the different causes of it. Interestingly, with anhedonia research, you see anhedonia in conditions like substance abuse or dependence, or substance use conditions, which I think her book really heavily focuses on in that area. But you also see anhedonia in things like schizophrenia, which is not a addiction model. And you see it in things like dementia and depression and trauma. Trauma has over 30 plus symptoms. And when in my lab, we use something called the CAPS-5, which is this gold standard metric that was developed out of the VA hospitals to look at all the symptoms of trauma that could possibly happen in an individual. And there's a whole bucket of symptoms where you're looking at this cognitive type of response where people either have like this low affect or they don't enjoy things as much. And so when I was doing this research in PTSD, I was surprised to learn, like anhedonia occurs in trauma too, right? And so, I think it's so fascinating that you can end up with this lack of pleasure and interest from trying to outrun a past pain or trying to seek pleasurable things to soothe from past pain, right? Because a lot of times in addiction and in substance work, people have this unprocessed pain that they're trying to soothe, but they just don't know how to. And they try to replace that pain with pleasure. And that leads them down this road where it's very difficult for them to experience pleasure without that substance present. Or the lack of the substance creates so much physiological pain because of the physical dependence that the only way for them to get even any relief from that is to engage in that substance. So it's really, I think, fascinating how anhedonia can take place. But I think that, with substances and with trauma, it's very, very present.
How would somebody start to tell if they're anhedonic?
Well, there's this scale that I've used for years in a lot of the depression protocols. It's well validated. It's called the SHAPS, and it was developed.
Would you spell that for us?
SHAPS.
Thank you.
And it's an anhedonia scale that is used across a lot of the literature. A lot of the new ketamine drugs that are out, the most recent FDA approved drugs, the intranasal ones, use a lot of these scales looking at anhedonia. And the scales are great, but they're old. So some of the questions on the SHAPS are things like, did you enjoy your tea, or did you enjoy the landscape? And I don't know very many people who drink tea and watch landscapes during the day, right? So I wanted to revamp the SHAPS, which is a very good scale, but include things that are like more modern pleasures that most people in the real world today could identify with. And so if you go on my website and you see my modified anhedonia scale, you'll see like more recent things and also more modern things, like when you're streaming your show. Do you enjoy it? Are you interested, or are you just kind of zone out? I wanted to include things that people actually do. A lot of
on your phone.
Westerners don't. Yeah, a lot of Westerners don't drink tea. They drink coffee. So if I put a beverage in there, like when you sipped your coffee, like was it pleasurable? Did you just chug it? And so when you look at the interesting thing about the anhedonia scale is that they're measuring points of joy, basic human joy. And when most people in the real world, outside of research, think of happiness, they only think of one emotion, like the smiling, like, oh, that's happy. But in research, when we measure happiness, we're looking at all of the basic human joys. So we're looking at things like when you reached out to your loved one and you spoke to them, did you feel connected? Or when you took a nap, did you wake up feeling refreshed? Or, when you ate your food, did you savor it? Was there an appetite? So we're looking at these basic human pleasures and we're adding these up to see if you're becoming happier. And that's how we measure whether or not you're getting happier. But most people in the real world think, oh, happy is just this like one emotion, like just a smile. But it really is your ability to engage in these senses and these daily human experiences and derive pleasure from them. And that's how we know if you're getting happier. That's how we measure it in the science. And, I was recently on this at this event with this suicide researcher, and she said, we've had to really shift our way of looking at happiness because a lot of people who have severe depression feel like they'll never achieve it. Now what we do is we ask them to try and engage in these senses and see if they can derive pleasure. And that feels more hopeful. And it just really validated the work that I'm doing and the research that I'm doing, because it's like, it makes sense, right? If you're only looking for one thing, like, oh, happy is this state and I'm smiling, versus happiness can be achieved through all these different avenues, then it is way more hopeful, it's more achievable, and it's more well-rounded and balanced. And
flexible.
It's more flexible. So when you use these scales and you're taking the questionnaires and you're looking at whether or not you have anhedonia, I'm asking things that are basic human experiences and whether or not you're able to derive pleasure from them. And that's how you know whether or not you're experiencing this lack of joy. And so, I would encourage people to take the scale to see where you lie on the scale of anhedonia. You may start to learn things about yourself that you just didn't pay attention to. Like maybe you don't enjoy being with your loved one. Maybe you don't enjoy these walks anymore. Why is that? And then you can start to figure out how to get back to that sense of joy.
Yeah, absolutely. Thank you. We've linked in our show notes already your quizzes on high functioning depression and anhedonia on your website. That's the scale. So your modified version of the SHAP scale can be taken on that link, right?
Yes.
Great.
Thank you, Judith. So let's connect this up also with the kind of the high functioning aspect of this, because a key point you make in your work is that to try and avoid facing up to high functioning depression, people just throw themselves into productive activities and use this term pathologically productive, right, to describe a tendency of someone suffering from high functioning depression. Can we dig into that? What does it mean to be pathologically productive?
Yes, when you think of productivity, you don't necessarily think it's bad. We've been trained to think that productivity is like a positive thing. But for many people with high functioning depression, when they're outrunning their past pain and staying busy, they're not necessarily enjoying or deriving pleasure from the work. They just don't know how to slow down, right? Again, remember when I said that if you're able to access the joy, great, good for you. But for people who can't, well, that's pathological, and I don't want to create new diseases or so forth. I use the word pathological to bring about attention to it, right? So if you're pathologically productive, that may look like when you leave work, you can't not check your emails. You have to constantly be connected. You feel uncomfortable not busying yourself. Or, maybe it's not even work related. Maybe it's related to a side hustle. You leave the workplace and you can't relax. You're not capable of slowing down. You have to take on 2 and 3 projects. Or you're that person who on the weekend, you're like cleaning out your garage, or like you can't, sit still. You can't enjoy your time with your dog or your loved one because you're just so busy. Those are areas of your life where you're losing out on those points of joy. And many times it's technology that's the cause. In my book, I talk about the biopsychosocial model and why is it that we're losing joy? Socially, many of us are losing joy because our lives are set up in a way where technology is just draining the points of joy from our lives. And I talk about this study that was published earlier this year out of University of Texas, where they removed the smartphone capacity away from these adults who were 18 and older. And what they did was they followed them over 2 weeks to see whether or not they were becoming happier or less happy. And what they found was that not having that connection to this smartphone and just using a flip phone or a regular phone allowed these people to have increased points of joy, almost as if they were being treated with an antidepressant. So they thought, well, what's going on here? What they found was that these people were actually getting more rest. They were getting more sleep. They were connecting to others. They were spending more time in nature. They were getting more movement. When they ate their food, they were actually tasting it and savoring it. So, socially, many of us cannot disconnect from this digital world, and that's where we're losing our points of joy. For others of us, maybe there's, again, that psychological component where we have this unprocessed past pain or trauma, and we're using busying as a coping mechanism to outrun this pain. So we just can't savor these moments because we're so busy. And so, I think that the biopsychosocial is so important because it allows us to understand where we're losing our joy based on our unique characteristics, based on what makes us so special and what makes us so different from the other person.
Hi, everyone. This is just a quick break to thank one of our sponsors, the Shipley School. We're extremely grateful to be supported by our friends at the Shipley School, an institution that has served as a trailblazer of well-being education for decades. Educating to Flourish is an approach to educational practice that promotes a focus on actualizing human potential. While this means continuing to prioritize the development of traditionally academic competencies, it also recognizes that these competencies are a small part of what leads human beings to live good, impactful lives. Using data-driven methods backed by various scientific fields such as neuroscience, educational psychology, behavioral economics, positive psychology, and more, the goal of Shipley's approach is to cultivate flourishing, the synergistic combination of well-being and optimal performance. Shipley aims to do so for all constituencies that make up the entire Shipley community. For more information about the Shipley School and Education for Flourishing, visit shipleyschool.org or contact Dr. Sharon Russell, Director of Student Support and Wellbeing. Thank you.
Hi friends, Nick here with just a brief interlude to share with you an update on one of our newest partnerships with the Anti-Fragile Academy. Throughout John and I's conversations with many, if not most, of our guests, one thing has been made really clear. In order for people to flourish, thrive, experience the good life, they need to develop the capacity to not only navigate and endure, but ideally grow from the bad, grow from unpleasant experiences. That's why we're thrilled to be partnering with our newest sponsor, the Anti-Fragile Academy, an organization that I co-founded with Dr. Adam Wright, Director of Mental Performance for the Washington Nationals. At the Anti-Fragile Academy, we work with adolescent athletes, executives, and educators to help them understand some of the science, not just of optimal performance, but of well-being and anti-fragility. The ability not only to endure and bounce back from unpleasantness, but to actually come back stronger, to grow from it. Between Adam and I, we've worked with Fortune 100 companies, Inc. 300 executives, Division I programs, and elite professional athletes and Olympians from all over the world. To find out more about how you can leverage anti-fragility training, check out our website at theantifragileacademy.com. I'm super curious, you're using joy, and how do you think of the word pleasure? Because joy feels very targeted to me, and in some ways what I hear you talking about is just pleasure more generally, that hedonistic sort of side, like trying to soak that in or savoring it. Because you mentioned that study, I'm curious, how did they measure happiness? Was it purely moments of joy, or do you throw surprise in there and excitement and love and connection? And this is a little nuanced and nerdy, but you piqued my curiosity.
Well, in the studies that I have conducted, I use validated happiness scales like the MADRS, MADRS, or the Hamilton Depression Scale, to look at all of these points of joy. On these scales, you'll see things like when you eat, are you savoring it? Is your appetite there? When you are reading a book, are you able to, stay present and focus on it? The Texas study, I have to look back at that. I'm not sure which one they used, but they were measured. Sure. I think it was very similar. But they're looking at whether or not you're able to derive pleasure from these basic human joys. When people think pleasure, they think of the extreme kind of like hedonistic, just like sex and drugs and all the things. But when you are not able to stay present and to just squeeze the basics out of, these simple human experiences, that is problematic. And so in that study that I was talking about at the University of Texas, they were looking at the basic pleasures in life, like sleep. No one would ever think, oh, sleep is hedonistic, right? You'd think, well, sleep is just a basic thing human beings do, but it can be quite pleasurable, right? If you're able to get deep sleep and restful sleep and you wake up feeling refreshed, that's something that we actually measure in happiness research, right? It is a simple joy. Being connected to someone and talking with someone and feeling loved and heard, that's a basic joy. It's not the hedonistic, just sex with random people, right? So when you look at your basic joys, look at the anhedonia scale, there are these simple things that we do in life that we take for granted. We're like, oh, that's just like a human experience. But we can actually derive points of joy from these basic human experiences. And when you add up these points, that's how you're measuring whether or not you're becoming happier, right?
Okay,
interesting.
So that's extremely interesting. So Nick asked about the distinction between joy and pleasure. So then happiness is a collection of joyful experiences, but also the person's ability to recognize those experiences as joyful.
Mm-hmm. Mm-hmm. Right. Happiness, in the happiness research, we're adding up these points of joy to see if you're becoming happier. In the regular, context of the real world, when people think of happiness, they think of this event that happens one day, this thing that happens to you. It's very dependent on the external. It's like, oh, if I finally get this job, I'm happy. Or if I finally have this family, I'm happy. Or if I get this dream partner, I'm happy. But, there's a lot of research that's showing that when people think they get these things, that they're actually not becoming happier. They're actually like, well, what's the next thing that's going to happen? Like they hold their breath for this thing to happen. They're still not happy. They're on to the next. But when you
The
reframe,
treadmill.
right, the delayed gratification, what
Yep.
is it called? The
Hedonic
fallacy.
treadmill. Yeah. Yeah.
Right. So you don't actually feel happy when you get to that destination. But if you can retrain your brain so that you're actually trying to experience the moments of joy and savor those moments and be present in those moments and intentional in those moments, that's how you're actually going to become happier, right? That's how you're actually going to get to that place. It's by being present in those moments. So with my patients, what I'll do is the busy ones. What I'll do is these grounding techniques, because they can't sit still. We do these very simple skills, and it's like 5 minutes at a time. I don't do it for longer than that. You build up, over time once you practice it. But I'll teach them to sit still in one moment, and we're going to do one thing together, and we're going to try to squeeze as many points of joy out of this one exercise. So if in my office, what we'll do is I'll have I have pretend this is tea, but it's water. I'll have them have a tea in their hands, and then what we'll do is we'll practice together. We'll both sit together, and then I ask them to be present in this moment, and then to practice this exercise at home or at work. So we're both focusing on this one thing, and we're going to try to derive as much out of this one moment as possible. But you have your tea, and I want you to list 5 things that you can see. So I'll have them describe, okay, what does the tea look like? The light flickering on the tea, their hands on the glass. Really just try to describe it as much as possible, the movement. And then 4 things you can feel. So you feel the warmth in your hand. You feel the glass against your hand. You may feel like the soft cushion under you, the soft. I have soft carpet in my office. And then 3 things that you can hear. And then usually there's, a sound machine in here, but you can hear the water going around. You hear the fingernails. 2 things you can smell. I usually have lavender and chamomile tea, but, you smell the fragrances. Those 2 fragrances in the tea. Then 1 thing you can taste. You taste the tea and you describe it. And then, when you get into that practice of doing this grounding technique, and I ask them, well, did you think about your meeting that's going to happen 2, hours from now? Or did you think about what happened last night? No, I was actually just focused on this one pleasurable experience. And, what that does is it shows them that it's capable. They are capable of deriving joy if they are intentional about it, if they can calm down. And when they practice this over time, they can do this anywhere, right? Rather than feeling the urge to, okay, when I get home, I have to do something. Let's just sit and let's do this with our food. Let's do some intentional eating, and we're going to describe all the flavors of the food, right? Or, if you're with your loved one or your pet, you're going to intentionally enjoy that moment of connection. So I practice this with my clients in very small increments, and then I ask them to do the homework and build on this over time. And they're able to squeeze these pleasurable moments out of things that they were taking for granted because they were so busy, because they weren't present.
Wow. Thank you for sharing. That's powerful. Do you notice, Judith, that some of your patients and the many other people you've worked with and spoken to, they're not even aware that they might be suffering from anhedonia because they make their lives and their schedules so busy that there isn't even the opportunity to notice whether or not they're feeling pleasure? Because the exercise you just got us to do then, the practice, was really noticing you're feeling pleasure. And I can imagine that's powerful for someone that doesn't ever stop to do that because their schedule's so jam-packed. And you mentioned that your patients are, extremely busy people living in Manhattan and so on, working crazy long hours and so on with no free time in their schedule often. Have you found that they, you have to kind of bring their attention to even notice when was the last time you did or did not feel pleasure from some experience? Because they don't even stop to do that.
Yes, they do. Absolutely. They know something is wrong. They just don't know what it is. And they come to me. A lot of times people come to therapy and they think that you're just going to you have this special key that you're going to unlock and then you're going to open up the doors for them, right? But that's not what therapy is. So they know something's off. They just don't know what it is. And many times, at the beginning of the sessions, the early sessions, it's just like building that trust, because these tend to be folks that don't open up, they don't share, they don't even know how to name emotions. On top of anhedonia, which again is already a very difficult word to identify, they also have alexithymia, where you ask them how they're doing, they say fine. They don't even take the time to really understand what they're feeling. So they don't know what it is, and they don't know that they even have it. And then when we start the work together and we're building that trust, then we learn that, oh, like there really isn't anything that's lighting me up. I didn't even know this word existed, but that is what I'm experiencing. I knew something was off. I just didn't know what it was. And so it does take time. It's not a quick fix. Anything in mental health takes time, because the brain is so complex. And if you've learned throughout your life that, you cope by pushing down your emotions, not feeling and just doing, you're a human doing, not a human being, then you don't know until someone points it out to you, or you have that moment of, oh my gosh, that's what it is. So many times they don't know it. And a lot of the work is trying to go back and see if there was a time when they were experiencing joy, and what was happening during that time. Who are you with at that time? What was your life like? Where were you? We do a lot of, kind of, I call myself like an archaeologist, like you're digging up the past with patients to figure out what was this time when you were feeling pleasure. So for some of them, we go back to that, whatever that past painful experience was, or if it's the, psychological component, or like what was happening in terms of who are you around, who was pulling your points of joy from you, who was actually supporting your points of joy. So we want to figure out what it was, when it was, what type of person they were back then when they did experience this joy. So we do this work together. And I talk about the different examples in my book of different, disguised patients throughout the years, when just going through different cases as to what some people were experiencing. Some of the cases are about childhood trauma, but other cases are about adulthood experiences and situations that led to their anhedonia.
You mentioned sometimes going back to context experiences where they were experiencing pleasure. What role does gratitude play? That sounds real close to like paying attention to good things that have happened in the past, right?
I mean, gratitude is, I think, a wonderful way to stave off anhedonia. If you're someone who is very busy and, tends to not really acknowledge or validate feelings and emotions or painful experiences, being able to identify and intentionally, honor these moments where you're deriving joy and meaning and purpose, I think is very important. I talk about gratitude in my book, and I think it's really useful. With regards to uncovering, moments in the past, I don't think gratitude is as helpful. I think what is helpful is validation. Like actually accepting and acknowledging when things happen to you. I think that has been useful in uncovering, okay, well, why am I like this? I think it's very difficult. I think validation is a very difficult step in this process of healing from high functioning depression, because I think many of us would rather just not deal with it. In fact, that's how we cope. We avoid. And so, validation looks like, okay, I'm going to take this anhedonia quiz and I'm going to say, wow, like my joy is low. And I'm going to accept that, rather than saying, oh, like joy is not important, or like, at least I have, this roof over my head and food to eat, right? Validation is very important. Validation also looks like, this bad thing happened to me and I didn't want to talk about it or deal with it or even face it or acknowledge it, but it happened. And maybe it has shifted the way that I view myself. Maybe it has shaped the way that I interact in the world. Maybe that's why I can't sit still, right? I think validation can be helpful in understanding and acknowledging why you don't have anhedonia. I think gratitude is a powerful tool in having this sustained healing and saying, let me just make sure that I'm taking stock of, these points in my life that I shouldn't overlook, these joys that I shouldn't overlook. And that may help you to, stay on a path of healing from high functioning depression.
Not really one or the other. We sometimes talk about mixed emotions, gratitude, right? That you see this sometimes in like CBT as well. You could easily gaslight yourself into like, oh, I shouldn't feel this way. I shouldn't think this. And I didn't mean to suggest that with my question at all. I think it's what I hear from you is the flexibility in some ways to exist in those spaces, right? But the reason I asked it, what I really like is the earlier part of the conversation felt like, well, you could go out and consciously craft and cultivate joyful, pleasurable, whatever language you want to use, experiences in a really targeted way to try to help with some of this. The gratitude and the looking back is like, well, maybe some of these things have already happened and we're just not savoring them in the same way we didn't savor the tea. And it seems like you're giving people multiple directions to try to attack a similar problem.
Yeah, I like that. That's beautifully said. And what you're talking about is it almost sounds like the vision part of my 5 V's, like acknowledging the things that are important, that do give you purpose, and planning them and making space for them, putting them in the future so that you do look forward to those things.
Yeah, it's great.
So engaging in effective gratitude practices is one thing people can do to reduce their risk of becoming, or what's the right way to put it, to becoming a high-functioning depressive person or getting high-functioning depression. Is that the right way to put it, Judith?
Either of those ways.
Yeah. Okay.
Sounds great.
Right, thank you. That's one thing. People just trying to dig into the practical side of this now, because we've gone through kind of ways that you can tell if you have any of the symptoms of this. Let's look at ways you can reduce the risk. So one way is engaging in gratitude practices. What other practices do you recommend people do to reduce their risk of becoming a high functioning depressive person?
I do think validation is important. When you acknowledge what you're feeling and accepting it without judgment, it's very difficult for many people who don't tend to want to face what's happening, and they just busy themselves. And then venting is very powerful, I think. In a lot of the depression research, there are all these questions about tension and anxiety and stress. And my patients are often confused. They're like, well, I don't get it. Like, why is there a question about stress and anxiety on a depression questionnaire? And I explain to them that, like, it's there because it's really difficult to access joy when you're stressed out, And then they're like, oh, I thought anxiety was on this part of the brain and then depression was on that part of the brain. And I explained that, no, we're seeing this connection that a lot of people who can't access joy are actually quite overwhelmed. And if you can figure out how to soothe from that stress, you can access the joy. It's literally not rocket science, right? It makes sense. And so I think venting and expressing, not just acknowledging, validation is acknowledging, but venting and expressing a lot of this anxious energy and getting it out, getting these frustrations out is very important in this work. And venting doesn't have to be just verbal venting. It doesn't just have to be talking about it, right? It could be through things like prayer, like expressing how you feel through prayer, or even crying. When my patients cry in my office and they say, oh, I'm so sorry, I said, don't be. Crying is actually really useful in getting that angst out. It's expressing how you feel. And, venting verbally to a therapist is maybe helpful, but when you do vent to someone who's not a therapist, really vent with intention. Don't just tell everyone how you feel, because if you do that, you're not going to feel better about yourself. If you're not venting with intention, with reciprocal care, then you're just trauma dumping, right? So when you do pick that one or two persons to vent to, those two people to vent to, be clear about who you're talking to. Is this someone who's going to help you to get to a resolution, or are you just gossiping? What is it that you're trying to get out of this? If you're trying to come up with a resolution, or you're trying to come up with a solution, be intentional about who you vent to, and don't vent to people who are like in a lower position of power. You shouldn't be venting to your kids or to your employees. So really be careful about who you talk to. Journaling is another way to vent. You're venting onto paper or however you tend to express it. Some people use digital journals, but it's another way to really offload. So that could be very helpful, especially with people who tend to push down their pain and to cope by overworking. Tapping into your values may be really helpful. I talk in my book, or I write in my book, about how many people forget what is actually really bringing them purpose and meaning because they're so busy chasing the things that have price tags and not the things that are really priceless. I was one of those people. I mean, you see like the gazillion degrees above my head. It was all about the clout and all of that. And I just found myself in 2020 being like, what am I doing? Like, why did I do all this?
You're not alone. You're not alone. Well, as you all know. Yeah.
And so that's why I started to post again on social media and be silly. And for me personally, when I look back to my past, and I had to be an archaeologist of my own past, the moments in my life when I was getting the most joy out of these experiences was when I was in the community helping people. My dad's a pastor. And every weekend, we'd spend a lot of time out in the community in YMCA, nursing homes, just entertaining people and lifting them up. And there were no price tags associated with that. It was priceless. And I found myself doing that on social media a couple of years ago, and I went viral. And I never thought I would go viral doing that, ever. I mean, some of these skits are just terrible. And I can't act, but I'm like, wow, it brought me so much pleasure helping people. So figure out what it is for you. I talk in my book about clients that, are incredibly successful, and they're just they're lacking joy, and they found that going back in time, and going back to these times where they were tinkering and using their hands, that's what brought them that joy. So figure out what it is for you, and try to tap into those values. And then, vitals, that's really supporting your body and brain, because you're only going to get one. So how do you support your body and brain so that you're squeezing as much joy out of these experiences? So I talk about nutritional psychiatry and about eating foods that are, support your cognitive health, that allow your brain to optimize the use of these nutrients, so that your brain is working with these neurotransmitters that are known to improve experiences, to make them more joyful. So things like leafy greens, eating blueberries, certain fish. This whole field of nutritional psychiatry is devoted to that, and getting the movement that you need, but also the non-traditional vitals of protecting your brain from technology, which we've talked about. So how do you support your body and brain, because you only get one? And then we talked about vision, planning joy in the future, and how that, is in a way a practice of gratitude, acknowledging, these moments that are important and that sustain your joy.
That's great.
Thank you so much, Judith. Just to sum up what we just said then, because the question there was about how to prevent getting high functioning depression, but I take it all of the practices you've described are also ways that someone who experiences high functioning depression can overcome it or reduce its symptoms, become less depressed, right? Through engaging in the gratitude practices, the reduction in use of certain technology, nutrition practices, and so on, and the 5 V's that you just mentioned, right?
Absolutely.
Awesome. Okay, well, this has been an absolutely fascinating conversation, Dr. Judith Joseph. Thank you so much. Where can our listeners and our viewers online learn more about your fantastic work?
Well, thank you for having me. It was a pleasure. It was extremely joyful speaking with you both. You can find me on my socials, Dr. Judith Joseph, and my book is sold wherever books are sold. And thank you so much for having me.
Thank you so much.
It's our pleasure, Judith.
Yeah, this has been mind-blowing. We highly recommend you check out Dr. Judith Joseph's book, High Functioning, Overcome Your Hidden Depression and Reclaim Your Joy. Many links in our show notes here, including also Dr. Judith's podcast, The Vault, the quizzes and scales that she's mentioned on high functioning depression and anhedonia, and many other things here today. Thank you so much. This has been Understanding High Function Depression and Reclaiming Our Joy with Dr. Judith Joseph.
Thanks so much for listening to Flourish FM. We hope you enjoyed the content. Please be sure to leave us a 5-star review and hit that subscribe button wherever you listen to your podcast and on all major social media platforms.
And if you visit our website, flourishfmpodcast.com, you can sign up to our newsletter. We send out a weekly newsletter. First newsletter of every month, we share a long-form blog, and every newsletter, every week, we share highlights from our previous episodes. Please hit subscribe on our website.